Hi. So I did my research project on understanding mass media health promotion through communication strategy and economic theory. Health promotion was introduced to the public in 1986. Since then, health promotion campaigns have become more and more popular, especially in the mass media and on those platforms. The World Health Organization formed a formal definition of health promotion, which is the process of enabling people to increase control over and to improve their health. Researchers have investigated the effectiveness of different health promotion campaigns through the strategies and techniques underlying campaigns, and also have done additional research regarding how the messaging affects behavioral factors. Researchers have found that these campaigns may not be fully effective due to the communication strategy and the behavioral responses and outcomes of the campaigns. My research project covers how health campaigns can be examined through an interdisciplinary lens using the understanding of communication studies, economic theory, and health promotion processes. The three disciplines provide us with further research and theory to explain the impact of health promotion on the public and individuals' health. The integration of these three fields allows for better insight, as communication studies offers insight into how the framework of messages affect perception. Economic theory can help to explain why individuals decide to act on the health messages and information or not act, and how individuals act or do not act rationally. Better understanding the health promotion processes and structure allows us to integrate more efficient strategy and technique into these campaigns. Looking at health promotion insight also is valuable, especially when looking at health promotion advantages and disadvantages. The mass media platform does have advantages to health promotion because it does a good job of exposing large groups and populations to health-related information. However, the use of mass media is often not effective because of its passive tone, cluttered media environment, poor formatting, and inadequate funding. The passive tone requires the audience to seek out further information on their own, which is a problem because individuals may not be motivated to do this. And the cluttered media environment and poor formatting may not meet the audience's expectations, which causes them to lose interest in the campaign, and inadequate funding may cause the campaign to fail altogether. Health promotion campaigns target a variety of aspects such as education and awareness, community engagement and collaboration, policy implementation and regulation, creation of supportive environments, and the utilization of different spaces and specific locations to deliver their messages. Campaigns also encourage individuals and the target audience to participate in activities related to the health behavior change. Information from the campaigns is spread through community health and behavior change programs, school-based education and workplace wellness programs, public screenings and health fairs, tailored programs for specific groups, and advocacy and initiatives for change. These different components and aspects of health promotion campaigns are important for the public to have knowledge of and need to be effectively communicated and introduced, while keeping in mind individuals' different levels of access to health education and resources. Looking at the communication side of health promotion campaigns, creators need to be aware of framing strategies and techniques such as gain and loss framing. Gain framing is where messages focus on the positive outcome of a behavior or change, while loss framing focuses on the costs and losses of not performing the behavior or change. The outcomes of framing depend on moderators and mediators, which include individual personality, perceived risk, motivation and emotional response, feelings and biases about the behavior, and cognitive processing. Better understanding how moderators and mediators work together rather than assuming behavior alone is what impacts health behavior outcomes can lead to efficiency within mass communication. Research has shown when to use gain framing versus loss framing and tells us that if there is a certain outcome, gain frame messages should be used, and if there is less certainty regarding the outcome, loss framing should be used. The prospect theory states that individuals are more sensitive to minor losses than minor gains and can be applied to framing techniques when matching framing to specific behavior types. For instance, you should use gain framing when promoting preventative measures and loss framing when promoting detection-based actions. Framing techniques should also be used in education materials related to health and interpersonal encounters with patients when discussing concerns and needs. The use of gain and loss frame messages can be used as an extension of health promotion to increase their effectiveness and capability to reach the target audience. The field of behavioral economics can be applied to health promotion campaigns as well, as it relates to individuals' behavior change and the perception of health information and messages. Behavioral economics is described as being grounded in empirical observations of human behavior, and it has shown us that people do not always make what is classified to be the rational or optimal decision, even if they are equipped with the information and tools available to do so. This science and psychology information can also provide insight into why or why not individuals make the decision to engage in health behaviors or change. The three principles of overconfidence, loss aversion, and self-control of the patient/consumer are the foundation of behavioral economics. Additionally, physicians and healthcare professionals should work to incentivize healthy behaviors and change, but they should also keep in mind that certain economic aspects may influence their patient's decision to make a behavior change. Some of the factors that physicians should keep in mind include limitations on information provision, the status quo bias and inertia, choice overload, the need for immediacy, loss aversion, relative social ranking, goal gradients and threshold effects, limits on willpower, and explicit direct incentives. Using all of the previous principles, behavioral economics can be used to transform the context and content of health promotion campaigns. Studies have shown that individuals act against their best interests, but this can be fixed by modifying health design programs, using incentives, and changing choice environments. These actions need to be especially considered when crafting and tailoring messages within health campaigns and formulating branding and marketing strategy into the campaign. Developers should also take time to survey individuals and use existing survey information about personal perception of content, formatting, and marketing approaches to determine and more accurately predict how a health message will be processed to the audience. Researchers have proposed a 7-stage behavior change process that individuals go through when reacting to and making behavior changes based on targeted health messages. The 7 stages are unawareness, awareness, contemplation, planning, initiation, continued action, and maintenance. Additionally, all of these steps are grouped into different engagement phases. The last component to this proposed explanation are the motivation and reward systems, which are approach motivation, avoidance motivation, and assertive motivation. One source of tension is that communication techniques often assume logical thought and perception, but behavioral economics shows us that individuals often do not have this logical thought process and make irrational decisions. Second, health promotion relies on the audience to be fully informed, which cannot be done if communication is not clear, and research shows that oftentimes health campaigns do not have efficient messaging, and therefore the audience does not make the behavior change. To create common ground between these fields, developers should focus on clear communication, the audience psychological motivators, and the goal of an overall increase in healthy behavior. The integration of communication studies and economics acts as an extension of the field of health promotion by using message framing and incentives and rewards to increase motivation and encourage action toward a behavior change. Health promotion professionals and campaign creators can use this research and findings from the areas of communication, economics, and health promotion to form a new model that aims to improve the effectiveness of health-related mass media campaigns and the resulting behavior changes and outcomes. This model should focus on strategic communication strategy through the use of gain and loss framing and implement incentives to target motivation and reward systems through psychological processes. The content of messages within the campaign should appeal to the rational decision-making of individuals within the audience and individuals' tendency toward risk aversion, while taking into consideration opportunity costs so that the individual makes the optimal choice when it comes to their health. Campaigns should also implement a process involving different stages that can help guide individuals through the 7-stage behavior change process. This can be done using incentive-based messages and actions. Testing this model can be done by developing and releasing a hypothetical health campaign to the public and then surveying the audience to see if the behavior or action was achieved and how the audience perceived messages within the campaign. Initially, my personal biases surrounding this interdisciplinary knowledge was that each of these fields were separate from one another. After this research and going through a multi- and interdisciplinary education, I better understand how knowledge of a variety of fields can lead to a deeper and more thorough understanding of all the aspects of a topic. This project has also allowed me to form a broader perspective and understanding of a big picture topic. Lastly, completing this research and forming a new model has shown me how comprehensive knowledge from multiple disciplines can be more useful than one discipline alone. In conclusion, mass media campaigns serve as a channel for potential and opportunity in health promotion, but have shown limited effectiveness so far in promoting healthy behaviors and improving public well-being, partly because of their format and tone. In the future, combining the disciplines of communication studies, economics, and health promotion can provide an interdisciplinary approach to use when developing these campaigns and understanding how individuals perceive and interpret health-related information and behavior changes. The different aspects of research that have been presented in these different fields provides a strong foundation for designing health promotion campaigns and messages that align with the audience's perceptions and decision-making processes.